Okay, good afternoon everyone. I'd like to welcome you to this webinar on the benefits and process of self-managing your government subsidised home care package. My name is Peter Scutt. I'm one of the founders of Better Caring. Before we get started, I might just go through some housekeeping. You'll notice there's a chat box located at the bottom of the screen, so feel free to ask questions as we go. And at the end of the webinar, I'm going to try and answer as many of those questions as we can. Don't be worried if you miss anything. We're recording the webinar and it will be available on our website, and also we'll send it out to participants. So as one of the founders of Better Caring, I guess I started this journey because of my aging parents. My father was in his early 90s was very frail. Mum was in her mid-80s with dementia. They were living at home in country New South Wales, and like many people, really wanted to remain in their own home. My sister was the person on the ground that was providing most of the family support, and they had services through a government subsidised package. And for them, it was an experience that many other people have of different workers being rostered through the home. When I used to go back home to see my mother and father, Dad would always talk about the different workers that were always coming through the home and how he really didn't need these strangers in his life, and he would rather deny services and say, just leave us alone, we're coping on our own, whereas in reality, they were really putting more and more pressure on our family resources. So that really led me down this journey of trying to work out how Mum and Dad could have real choice over the people coming into their home so that they didn't feel like they were losing control of their life and who was going to support them. We've been operating more than 3 years, so we're well established as an online platform today. As I mentioned, this webinar is about self-managing your home care package, and what I'd like to think is at the end of this webinar, you understand more about home care packages. You understand that self-management is an option that's available today, and it's relatively easy to do via Better Caring's online platform. Also that you can understand that by being a little bit informed and taking a little bit of control, you can get dramatically better outcomes from that funding or from that package. You can be doubling the hours of care and support from a team of workers that you choose and schedule around your life and around your preferences and needs. And finally, you should be able to get started self-managing your package by the end of this webinar. So we might start at the very beginning, just talking or recapping on what is a home care package. I suspect most of the people listening today do have a home care package, so I won't dwell on this. But it's a government subsidised program that provides funding to people as they age to help them stay living at home independently. Now that is the overwhelming preference of people to remain living in their own home and in their community as they age. The starting point for getting a home care package is the My Aged Care website or contact centre, which will do an initial screening. And if they think you might be eligible for a home care package, you'll be referred to an ACAT team, an aged care assessment team, and they'll do a more thorough assessment. Now, all home care packages are now consumer directed. And I'd like to think that everyone's heard that term, but we often find that people haven't. But what the government forms is making more packages available or more funding available for people that want to remain living at home. They recognise it is the overwhelming preference. That funding is now all provided on an individualised basis. So unlike the old model where the government was funding providers to deliver services, the government is now funding consumers or funding you to purchase the services that are important to you in your life. So you now have choice over services, and you also have choice over who delivers those services and when. And that choice over who also extends to the individual workers that come into your home and support you within the home or within your community. We talked about individualized funding. I just wanted to quickly run through this. There's 4 levels of home care packages. Each has a particular government subsidy amount attached to it, ranging from level 1, $8,158 per annum, down to a level 4 package of $49,593. Obviously, this is based on your assessed need. The ACAT team makes that assessment and allocates a package, and you get the funding associated with the package. You may be asked to contribute financially to the package, and that will vary depending on whether you're a pensioner, a part pensioner, or a self-funded retiree. But I won't go into that in this seminar. But at the end of the day, you'll end up with these amounts of money. that really are individualized and you have available to you to try and achieve the best outcome. There is also various supplements available. For example, if you have a dementia supplement, that will add another 10% to the government subsidy amount. So typically through home care package providers, these amounts of funding have been associated with a certain number of hours of care and support you might be able to afford. So with a level 2 package, we would typically see that delivering between 2 and 4 hours per week under a traditional home care package. Level 3, it would be 7 to 8, and level 4 around 10 to 12 hours. Now, you could be getting substantially more hours than that. So, you could be getting for a level 2 package instead of 2 to 4, you could be getting 6 to 7 hours. And on a level 4 package, instead of 10 to 12 hours per week, you could be getting 20 to 24 hours. And this webinar is going to sort of explain to you why that is possible and how it's actually very realistic and is being achieved today by many consumers who have taken the step of self-managing their home care package via Better Caring. Also, I wanted to talk a little bit about the services because they really can be quite broad. So it extends from everything from domestic assistance, meal preparation, assistance with shopping, home and garden maintenance, transport. These are things that people need in their everyday life as they age. It extends into personal care and into nursing services, assist with medication, if you need a physio or OT to keep you mobile and get you back on your feet. It also extends into supporting you to remain engaged with your family, with friends, within your community, and to stay connected and engaged with the things you've always loved to do through life. So when you relate the previous slides where you can actually get more hours of support from the same government funding, suddenly some of that funding can actually be used to achieve some of these other aspects of your life that really are important to somebody that wants to age well at home and remain engaged, as I said, in the community and in the things they've always loved. The Consumer Directed Care Package or CDC package, it's now allocated to and it follows the consumer, not the provider. So that means you can move that package, you can switch it if you like, from one provider to another to get the best value and to get what you need from the package to live a life of your choosing. So what does all this mean for you? It means that you now have more choice and control over the services you receive, who provides them and when. It also means that providers are now competing for your business. So you're in the driver's seat with providers competing for your business, and informed consumers can get a much better deal, and that's what we're going to be talking about today. For consumers, we know there's certain things that are important to them. So aging well is really what it's all about, quality of life. And we know that means different things to different people. So for some people, it's about staying connected with family. For others, it's about being outdoors. For some, it might be a glass of wine and a meal with friends. So everyone has individual needs and preferences as to how they're going to enjoy life as they age. And so one of the things we talk about is real choice is important. In other words, your choices aren't restricted by a menu that's provided by a provider, but you really are in the driver's seat and you can choose from diverse services and diverse people that really meet your particular needs. And we know that quality of service is important because it's really about quality of life. But also the other side of the coin is the cost of those services. So if you can go from 10 or 12 hours a week to 22 or 23 or 24 hours a week from the same funding, that will directly impact quality of life along with the quality of those services. And the other thing that we know is important to consumers is that relationships really matter. And for consumers, the relationship with the individual care and support workers they engage in their team is really important, and vice versa. So bringing people together around mutual choice is really the basis for letting long-term good relationships develop between those that need care and support and those that are willing to offer it. So innovative models like Better Caring, and we're going to talk a little bit more about how it works, can offer significantly more hours, in many cases double the hours of support from the same funding while workers are earning more. You can get those services from people you choose and schedule according to your needs. You can suddenly start to think about people in your community that you would like to be involved in supporting you, whether that's neighbours or friends or other people, workers you may have worked with in the past. It's also a compelling option while you're on the home care package waitlist, of which there are many people, because it's an affordable option. And uniquely, if you engage a team via Better Caring when you do get your home care package, you can continue with that team once you have an approved provider that hosts your funding. And also the other thing that we like to talk about is this model actually creates local community jobs. So if you're going from 10 to 12 hours of support to 22 or 24 hours, that's an extra 10 hours of support a week, but it's also 10 hours of extra work that's available to somebody that lives in your local community. I wanted to spend a bit of time talking about the unbundling of the traditional home care package service offering, because I think this is interesting when you start to think about how you might self-manage. So historically, the traditional home care provider generally delivered everything to you. They hosted the funding, did the administration of that funding, they did the case management, and they delivered the services. So they provided everything to you in a package, and for that, they tended to retain 100% of the package funds. What I think you'll see, and what we are seeing with consumers now being in control of the funding and making purchase decisions based on what's important to them, is we'll start to see that service offering unbundle. So with self-management, you can choose, or you can buy, if you like, what you want. So you should be able to buy independently funding, administration, case management, and services. And when you look at what's important to a consumer for each of those elements, when it comes to administering your funding, what you really want is that to be done very efficiently for low fees. You don't really want any exit or entry fees. I think that's fairly self-evident. When it comes to case management, and case management is really, in our mind, client advice. It's really helping you understand what your life could look like and what the possibilities are through a home care package, and trying to help you get the best outcome. And really you want that advice to be independent of services. And also you want that case management or advice to be flexible or tiered. So you may not need a lot of advice if your situation is not very complex, if you have a lot of family around you, so you don't want to be paying for it. Vice versa, you might need quite a lot of case management to help manage your circumstances. And then when it comes to services, you clearly want to be able to purchase what you want from somebody you choose at a price you agree, and that should be open access to and choice over services. So, the concept of self-managing is really a choice. Consumers will have the choice of a full service offering at one end of the spectrum to a completely self-service offering at the other. So we talked about the bundled offering at the full service end of the spectrum, and then at the self-service end, you'd expect these services to unbundle. And if you can pay less for admin because somebody's more efficient at it, and you don't need a lot of advice, so you purchase less, then you'll have more money available for services. But we expect that people will have access to tiered case management, and how much case management or advice you need is going to vary from person to person, and will likely vary over time as your circumstances change. So there will be times when you want to purchase a bit more advice, which may mean that you have a little bit less money available for services. But this really should be at the choice of the individual consumers and families. What we're doing at Better Caring is working with progressive approved providers who will offer a self-managed home care package to consumers. They'll offer that option to consumers, and they support real choice. So what that means is the approved provider is efficiently hosting the package and providing that tiered, flexible level of case management. And because they're managing the package flexibly, and you may not need to purchase a lot of case management, you'll have more funds available for services. The consumer can then choose and schedule the workers via the Better Caring platform, and by engaging independent workers directly, they'll pay less than they would pay for the services delivered through a traditional provider. The consumer then approves the electronic timesheet via the Better Caring platform, and we would collect payment from the approved provider that hosts your package. So that's the mechanics of how this would work. So a self-managed home care package looks a lot like this in the current form. So an approved provider does the funding administration. They do that very efficiently. The fees are typically lower because you're doing more of the work, choosing and scheduling your own workers. The case management, as I mentioned, is tiered and flexible. So the approved provider offers those two components generally, and you're free to self-manage the services via Better Caring. So you can use the platform to build and schedule your own team around your particular life. And instead of taking 100% of the funds to deliver everything to you, what we're typically finding from providers that are offering a self-managed option is that they might charge 10 to 20% of the funding to provide the case management and the fund administration, leaving you with 80 to 90% of your funding to actually spend on the services that are important to you. So I wanted to illustrate just how this breaks down, because this is actually how you can go from getting 3 or 4 hours from a level 2 package. In fact, it's really 2 to 4 hours, because you see many people getting 2 hours from a traditional package, to actually being able to access 6 or 7 hours. So my eyesight is no longer what it used to be. So I'm putting my glasses on to read this. So you have to bear with me. But the level 2 home care package, as you can see from the screen, it's worth $14,837. Now, depending on whether you pay the provider 40% under a traditional model to do the administration of case management, or 15% under a self-managed option, you're left with either 60% of the funds available for services or 85% of the funds. And you can see that's quite a dramatic difference. The other thing is that the cost per hour for services, typically through a provider, is around sort of $46 to $50 an hour, and you can check with traditional providers what they're charging for those services. And often the workers that are delivering those services are being paid something in the low 20s or mid 20s an hour. And what we're able to do with Better Caring, because we're enabling the workforce to be self-employed and offer their services directly, you can engage them quite at a rate that's quite substantially below what a home care provider would charge versus what the worker would earn. So consumers can pay less and workers can earn more. So in this example, you can engage somebody at $35 an hour. So the combination of having more money available for services and paying a lower hourly rate means that you can go from 3.6 hours a week in this example to 7 hours. So typically, as I was saying earlier, typically a level 2 home care package, consumers are getting 2 to 4 hours a week. By self-managing, they're typically getting 6 to 7 hours a week. If I look at a level 4 home care package, we go through a similar exercise. The package value is $49,500. If you're left with 85% of your funds, you're left with $42,000 to spend on services, versus a traditional provider might leave you with less than $30,000 a fund. Again, that's a dramatic increase in the amount of money you have to pay for services. By engaging the workers directly through Better Caring at $35 an hour, you end up going from 11.9 hours a week to 23 hours a week. So, looking at that level 4 package, going from 12 hours to 23 hours each and every week is really life-changing, and it really offers the ability for people to stay living in their own home, and it also allows them to age well by having more hours of care and support and being able to devote some of that funding to engaging support that actually helps them live a life where they remain connected with their community, with friends, with activities that have been important to them. In our view, consumers want to stay living at home. I think it's very difficult for consumers to remain living at home if they're only getting 10 to 12 hours of care and support each week from a level 4 home care package. They need more from that funding, and I think we need to see innovation emerge that delivers more. And I think self-managing your home care package by Better Caring is just the sort of innovation that I think is needed, not just for individual consumers, but I think the government needs to see innovation like this emerge. There's also 80,000 people on that have home care packages, and of those, 37,000 people have packages below the level they've been assessed for. And this is typically people that have a level 2 package that have been assessed for a level 3 or a level 4 package. Now, that by definition means that there's 37,000 people that need more from their funding. They've been assessed as having a greater need. The packages aren't available at the moment, and so in the interim, they really need to get, again, more from the funding. And let's not forget the 55,000, or I think it's more now, people that are on the home care package wait list who could be on that wait list for more than 12 months, and in the interim are going to need an affordable solution. But interestingly, we've been, as I mentioned, operating Better Caring for over 3 years, and we've had a lot of consumers, that are paying privately and that have government home care packages coming to Better Caring to engage their own team. And one of the interesting things is many people, in fact about 3/4 of the people we speak to, have limited or no understanding of consumer-directed care. They're essentially in the dark about these important reforms that really give people choice and control. So 75% of people, by definition, have little understanding of the fact they have individualized funding, often little understanding of the extent of choice and control that they have over that funding in terms of choice of services and who delivers those services and when. and have very little understanding that self-management is an option. And we often find that they're being misled in terms of what their options and rights are and how consumer-directed care packages operate. Our sort of mantra is to try and get consumers to understand that by being a little bit more informed, by being willing to take a little bit more control through self-managing their home care package, by better caring, they can get dramatically better outcomes. So they can get many more hours of care and support from the same funding. They can get that support and build relationships with workers they're choosing, and they can also find and develop that support from within their own community. And as I said, that's getting dramatically better outcomes for people. So this is sort of game changing. So I just want to recap on this. When you self-manage your home care package, the provider charges lower admin fees because you're able to do more of the work, and you're able to do that easily via the Better Caring platform. If you don't lead a lot of case management, you don't have to pay for it. So the providers are being more flexible around the case management offerings they have to consumers. That leaves more money available for services, and by engaging the workers directly via bettercaring.com.au, the consumers are paying less per hour while the workers are earning more, and that's what's leading to this dramatic increase in the number of hours from the same funding. The fact that you have more funding available for services and you're paying considerably less than what the provider historically charges to deliver those services. So I'll just quickly turn to what is Better Caring, just so we can bring that to life a little bit. It's an online social platform. It enables consumers to find, connect, and directly hire independent care and support workers, nurses, and therapists. This model gives consumers diverse choice and control over who supports them, while care and support workers have choice as well, and they feel more valued and fairly compensated. So it's about bringing consumers and workers together via mutual choice. So essentially, this online social platform enables communities to better care for and support people within their community. So Better Caring is a place where people gather, they connect, they transact, they build relationships, and they provide feedback on that experience. And through this online social platform and through this process, it's very empowering to everyone that engages with it. So you get to choose. It's very efficient, so the savings can be shared between the community, the people that need the support, and the people that offer it. It's very transparent. Everything is driven by ratings and reviews, and you can read people's profiles and what credentials they have and what they charge for services and what services they offer. And through the platform, you're able to access very diverse, flexible, and responsive services. So it's really a very easy process. Again, in this example, we've got Fran and a mum visiting the Better Caring website to search for workers in their area. They look through those profiles and search according to their own criteria. And in this case, they're attracted to Lisa, who had a background in nursing, and they really liked the way she articulated who she was and what she was offering. So they've now engaged Lisa to help Fran's mum, in particular, sort of get outside and maintain the connections within her community. And through that process, as we mentioned, Fran's able to get twice the hours of care each week from the same funding. So again, just to recap, you search on the platform based on criteria that's important to you. You can look at the location, qualification, interests, personalities of workers. You can look through their profiles in a level of detail, and you can read feedback on those workers from the community. They're rated and reviewed. And you can also start to consider who you know in your own community that you'd like to involve in your care, and we can bring them into the Better Caring community about onboarding those workers and going through our normal registration process. You can message workers via the site and arrange a meeting or interview on your terms. So some people message them and arrange a telephone interview. Some people like to meet at a local cafe and see if there's a nice fit, because often, what's important to people is connecting with people around their individual sort of motivations and attitudes and values and interests is often more important to consumers often than the experience or qualifications of workers. So meeting and assessing whether it's somebody you like and get along with and who respect you is all part of the process of trying to identify a team that works for you. You agree rates and the schedule and services directly with the worker. They're self-employed and are able to agree the services directly with you, and that's documented through an offer and acceptance process through the Better Caring platform. And when services are delivered, the worker completes an electronic timesheet, which the consumer accepts, and all of the records are kept online, and we will go and collect the payment from the home care provider that hosts your package based on the timesheets that you've accepted from the workers you've chosen. And full record keeping is available to the consumer and the worker on the website, and to the home care package provider, as that may be an important part of them discharging their responsibilities as an approved provider. The platform operates where we're totally committed to the safety and safeguarding our community. So all workers that offer services via the Better Caring platform, they go through a strict onboarding process. So we check police checks, reference checks, certain qualification checks. If they're working with people with a disability, we do working with children checks. We look at the nursing registration of people that want to offer nursing services. If they're offering assist with medication, they have to have that module in their training. And you know, again, if they're offering personal care, they'll need to have a certificate 3 or 4 in aged care or disability or home care or an equivalent. All the workers that deliver services via the platform have insurances that have been arranged on their behalf. So they have public liability, professional indemnity and group personal accident through Zurich, our insurance partner. And everything is sort of managed seamlessly on the platform. So, you know, it's a full transactional site. Workers complete timesheets. The platform raises invoices on behalf of the workers. They are accepted by consumers. Payments collected. Consumers can rate and review their experience with workers, and those ratings and reviews influence search results. And the average rating, star rating for workers on the platform by consumers is 4.7 out of 5 stars currently. We've got many case studies. I'll just touch on Jack for a minute. Jack has dementia. His daughter arranged for a worker to come in to take Jack to a variety of outings. So for the first time, Jack's able to get out of the house, spend time with his sister that he wasn't able to keep in contact with, and they do activities together, including going to galleries, going for walks, having coffee. So Carol's on the record as saying at 91, it's a new life for my father, it's marvellous. So in her mind, his life is improving through being able to engage services that are directly related to what he wants to do in his life. We also operate in the disability sector. This is Grant. You know, he says that Better Caring gives him the flexibility he needs to live his life. Interestingly, Grant also has a level 4 home care package, and he manages his team of workers via the Better Caring platform. So in order to get started self-managing today, I just wanted to recap on these things. The first step is really to start identifying your individual support team. So you can do that in a couple of different ways. You can sign up to the bettercaring.com.au website now. You can start to search for workers in your area. You can contact them to see if they might be suitable to be part of the team that's supporting you or a family member. Plus, I really encourage people to think about who they know in their existing community and network. So it can be some existing support workers you've had in the past. They can be friends, can be neighbours. But there are often people that you know that your family member or you feel very comfortable with that might be able to provide domestic assistance or meal preparation or help with shopping or some companionship. The second thing you need to do is look at selecting an approved provider to host your package. So as part of that, you can call us on the 1300 number there, and we're very happy to connect you personally with the approved providers who offer a self-managed option in partnership with Better Caring. Those providers all have competitive admin fees and have flexible case management and are very responsive to consumers. The third step is to then engage your team and be able to approve timesheets via the Better Caring platform, and we essentially do the rest. So based on those approved timesheets, invoices will go to the approved provider that hosts your funding, and they will pay for the services that you've engaged. A question we often get is, how do I switch approved providers to start self-managing? Again, we can connect you with approved providers that can host your package. They'll also help facilitate switching, so they'll talk you through that, and they'll also help you get started self-managing, and you know, they're very familiar, as I said, with the Better Caring platform. You'll need to reactivate your referral code from the My Aged Care website, and that referral code you need to provide to the new provider. It's important that in your conversations with your existing provider where you're terminating services and the new provider where you're commencing services, that those time periods don't overlap. So make sure your start date is after the end of the date that you've agreed to finish services with the previous provider. And also, unspent funds will be moved across to your new provider, but there may be a delay in the time it takes for those funds to come across. And also be aware that, you know, some providers are charging exit fees that cover their administrative costs of switching to a new provider. We've seen other cases where some of those exit fees look quite excessive. So when you do choose an approved provider, be aware of their fee structure, and in particular their ask everyone today that's listening is spread the word. You know, we want people to know self-management's an option. Consumers and workers can start to benefit from engaging in self-management and models like better caring, and also spread the word about better caring, because the bigger our community, the better we can serve everyone that engages via our platform. So I think that sort of brings me to an end, and we've probably got a whole bunch of questions, and the team here have been furiously transferring those questions onto cards, and I'm happy to sort of read them out, and we'll try and answer them as best we can. So what interim support does the government provide for people waiting for a package? So there is a number of different programs, and we've been talking about home care packages, which are available for people that have more complex ongoing needs that requires an ACAT assessment. When you go through My Aged Care and you go through the initial screening process, if you need lower level services, basic entry level services, and they may be more sporadic, you can actually get services through another program called the Commonwealth Home Support Program. There are, I think, about 80,000 home care packages available, whereas there are about 1 million people receiving some form of services through the Commonwealth Home Support Program. That program is still block funded, so you'll be able to find through My Aged Care. If you do speak with them, I'll get you to have a regional assessment service assessment, but they'll be able to direct you to services available in your local community that are still funded by the government. I guess so I think that's the main piece of advice, is to, you know, speak with My Aged Care, potentially have a RAS assessment and see what services are available in your local community that are funded through the Commonwealth Home Support Program. This is the next question. I'm a case manager for a progressive provider. How can I use this with my customers? So we work a lot with what we call progressive home care providers, and I guess we use that term to talk about providers that we think put the consumer at the centre of their business and take the approach that we don't own the consumer and we want to respond to them based on their preferences. So some of these home care providers might offer a full service option at one end, but also a self-service option via better caring at the other. So those providers we have a close working relationship with. They typically have a self-managed home care package offering, so it's lower admin fees and some tiered flexible case management fees. The case managers at those organisations are generally pretty quickly able to recognise a consumer that's going to benefit from self-managing. So if you've got a consumer as a case manager that wants to have more choice over the individual care and support workers that come into their home, they want to be able to schedule those services around their life. And if they need more hours of care and support, then it's quite likely they're looking for something different. And as a case manager, we also have organisational logins to the platform and case manager logins to the platform, and you're able to help your clients engage with better caring and be in the background via a connection of the consumer's account to the case manager's account on the platform. That's probably a bit of a summary, but I would encourage you to call us on 1300 736573, and we're happy to talk through that in more detail. But I think more and more, you know, we see organisations, case managers really putting the consumer at the centre and trying to work out how they can help them achieve the best outcome from their funding. The next question is, I live in a small town, no better caring workers, but people looking for work. Can I hire them? Absolutely, you can, but it has to go through a particular process. So we've been set up to actually fulfill this and accommodate this, and we think it's an important part of how aged care is going to work in regional and rural and remote communities, which is people are going to find the support from within their community. And not only that, if they do that, it actually puts the money back into those communities in terms of local jobs. So what you can do is register with the Better Caring website, give us a call on that 1300 number, let us know who the workers are that you'd like to involve in your care and support. They will need to register on Better Caring. So one of the things we do is we put all the checks and balances around that. So as part of the normal onboarding process, that worker would create a profile about themselves. We will check police checks, reference checks. We'll check any qualifications that may be relevant depending on the services they're offering, but in many cases, they don't need any qualifications to offer domestic assistance and community support. And those workers will have insurances in place, etc. So once they're on the Better Caring platform, you can engage them, the invoicing happens through the platform and payment is collected and made to them via the platform. So we're very much encouraging this as a community-based solution for people to be able to find care and support from within their own communities and networks. What exactly is case management? Look, it's a term that's been in aged care for some time. It's actually a term that's now changing. People are talking about it being coordinators or client advisors. So it's really people that are able to sit down with a family and develop an individual care plan with that family. So the family's taking the lead in terms of what they need in their life to age well, and the case manager is helping them think broadly about the types of things they can access with their home care package and developing that into a individualized care plan. Everyone that has a home care package has an individualized care plan. And then the case manager would allow the family to then put that plan into action. They'll also be the point of contact for the family as circumstances change. So they'll likely stay in contact with that family. You know, depending on the circumstances, it might be quite regular contact if it's a complex case and the family needs a lot of support, or it might be a couple of times a year where the family is very comfortable self-managing a non-complex situation. But they'll help the family make sure everything stays on track, or the individual keep everything on track as they age. Can you engage a family member with your home care package? Look, that's a good question, and you generally can't, is my understanding, but I think you may be able to in certain cases. So if that perhaps is the only option available to you in a remote community, that may be a possibility, and that would be something that you would discuss with your case manager, and they could look at it on a case-by-case basis. But it's not generally the case that you can employ family members to deliver the services to another family member. This is a question that relates to an earlier one. Does the service provider still have responsibility for developing an aged care plan? Do they own responsibility for well-being and any risks? So look, that is a good question. So under a self-managed home care package arrangement, the home care provider is still under government funding arrangements, having to comply with the Home Care Act and with home care standards. So they still have responsibilities as a home care provider, and they have a duty of care to the client. And that duty of care is to make sure that, you know, the client's acting reasonably in the choices they're making with regard to their home care package. Now, different providers have different levels of risk tolerance around putting the consumer at the centre and supporting them with consumer-directed care. Some providers are more flexible and more willing to take acceptable risks that the consumer can make choices as long as those choices are reasonable and comply with the Act. But they also rely on a number of things the Better Caring platform does in terms of checking police checks, references, and how the platform operates. They are still responsible for developing a individualised care plan. So the home care providers that offer a self-managed option, their case manager will meet with you as part of the process of moving your package to them, and they will develop an individualised care plan, and they will agree the touch points thereafter based on your needs and preferences. So it's a matter of trying to understand how a self-managed option can work within the home care package arrangements that the provider has with the government and the obligations it still has a government approved provider. What costs are involved in using Better Caring? So what we do is we put independent workers, self-employed workers directly in contact with their clients, and they're able to work out and agree the services and the schedule and the price for those services. So workers have indicative prices on their profile. They agree that with each consumer based on the nature of that engagement. And that's an arrangement entered into between the consumer and the worker. What we have is some small charges that occur as payment is collected. So if, for example, the worker and the consumer agree $30 an hour, we have a 5% service fee for the consumer. So we would charge an additional $1.50 an hour as a Better Caring service fee. And the worker would receive the $30 less a 10% service fee that the worker pays to Better Caring. So that covers all of the onboarding of the workers, which we do free of charge, the operation of the website and the call centre here, as well as the insurances that are arranged on behalf of the workers. And to give you an example, or to put those fees in perspective, often a traditional home care provider might be charging, as I mentioned, $48 to $50 an hour, paying a worker something in the $20 an hour plus super. And in our case, if the worker and the consumer agree $30 an hour, our fees would total $4.50 an hour. So all of those savings by this model then get shared between the consumer and the worker in terms of the consumer paying less and the worker able to earn more. But one of the things we've also found over time is, consumers really value workers, and over time we're seeing them willing to pay the workers a little bit more to recognise the great work that they do. So there's a question here: if I use you for an interim solution, who will do my care plan? So that is a good question. We are, as I mentioned, a platform that connects people. So what we would do is connect you with case managers that could sit down with you and develop a care plan. Now, some of those case managers might be available through home care providers that offer that service. But increasingly what we're seeing is a merge or independent case managers. So people that have a case management background that are willing to be independent advisors to consumers around their aged care needs and how to get best out of their funding. So we're certainly willing to refer consumers to case managers that we know that operate independently and can provide that service to consumers paying privately in the interim. I think that brings us to an end in terms of the questions. If people do have further questions, there's an email address on the screen, info@bettercaring.com.au. Feel free to send those questions through there or call us on 1300. We always like to receive people's calls, and we'll do our best to give them our perspective on the best way to go forward. Thank you very much for listening, and I'm encouraging you all to take a different approach to the way you manage your home care funds and the way you engage your team of care and support workers. Thank you.